Everybody. Hello, Dr. Aswaji, Dr. View, Danu, Chris. Thank you so much for joining us this evening. I am going to be recording this, so we'll be able to access it on our website and probably on our Facebook page as well, so we can revisit this at another time. But welcome to Garnet Health's Self-Care Forum series. This evening, we're talking about physical, emotional, and mental health. And I will introduce our panelists. So starting with Dr. View, he obtained his doctorate in osteopathic medicine at the Philadelphia College of Osteopathic Medicine. He completed a fellowship in psychoanalysis at the New York University, his family medicine residency at New York Medical College in Brooklyn, Queens, and his psychiatric child and adolescent psychiatric training at St. Luke's Roosevelt Hospital Center. Dr. Aswaji obtained her medical degree from, I apologize, Dr. Aswaji, Obafemi Olowo University in Nigeria, and completed her residency in internal medicine at Icahn School of Medicine at Mount Sinai in New York. She's in board certified internal medicine. Chris Johnson is a family medicine practitioner in pediatrics and primary care. He obtained his master's of nursing from Dominican College in Orangeburg, New York, and he graduated with honors and a bachelor's degree in nursing from Chamberlain University, nursing in Downers Grove, Illinois. He has been with Garnet Health since 2005, first at Garnet Health Medical Center in Middletown, and he's currently with Garnet Health Doctors in Primary Care and Peds. Danu Sansi is the president of the National Alliance of Mental Health Illness, NAMI, of Orange County, and a NAMI New York State Board of Director Crisis Intervention Team member. She's been a NAMI member for 29 years and joined due to her family's personal mental health journey. Danu teaches and facilitates a number of support groups in the NAMI program and is dedicated to ending the silence in school districts and helping students recognize early signs of mental health conditions. So thank you all for joining us this evening. We'll get started with the National Alliance of Mental Health Illness, NAMI, is the nation's largest grassroots mental health organization dedicated to building lives for individuals and families affected by mental health conditions. According to NAMI, 1 in 5 US adults experience mental illness, and 17% of youth ages 6 to 17 years old experience a mental health disorder. What is mental illness and why is it so hard to talk about?
Okay, can I start? Okay. Well, I would say that mental illness is any form of psychological trauma or insult. So mental illness can come in the form of depression, it can come in the form of anxiety, it can come in the form of trauma. And I think it's also very important to say that as a psychiatrist and also as a person that has a background in primary care, when we look at mental illness, we have to look at two important components, which is ego-dystonic and ego-syntonic. What do I mean by that? Ego-dystonic is behavior that really bothers you. So if, for example, the person that suffers from depression, the person that suffers from anxiety, or even substance abuse issues, that actually bothers them. But you also have ego-syntonic behavior, and that is behavior that does not bother the person themselves, but the behavior is adversely affecting people around them. And in many ways, this type of behavior, the ego-syntonic behavior, is profoundly difficult to treat. So examples of ego-syntonic behavior would be behavior that includes personality disorders. So that can also be very, very problematic. And that can also have very deleterious effects if not treated adequately. So I would say that that would be a general description of mental illness. And one thing I do want to say, because you made a great example of saying like 20% of all adults have a mental health disorder, as well as 17 to 20% of child and adolescent people may have child mental health disorders. But another thing that I want to kind of also talk about is that even though 20% of all children and adolescents may have a mental health disorder, only 20% of that 20% is actually getting treatment. And that is the key thing. A substantial amount of our population have a diagnosable mental illness, but they're not getting treated.
I would like to add something to that. Actually, in our language, when when a person is not, inability to function in their everyday life, like get up in the morning and get dressed, when it affects their everyday living, that's what we call mental illness. I mean, if it affects their thinking, their behavior, and also they say the inability to live, learn, laugh, and love, that is mental illness. And why, I mean, like your first question, why is it so hard to talk about? Because of the stigma, discrimination, shame, and guilt. So that's why many people don't go for treatments. They do not, and also the cultural beliefs, that also plays a big role. So there, in some of the cultures, yes, they don't go for this, seek the treatment. They think that it's a shame to go to the professional. So they try to solve it within the families. So it's mainly because of the stigma, discrimination, and even logistics, the transportation. Those and lack of motivation, lack of access to services. Those are the things plays a big role as barriers.
Chris, did you have something you wanted to add?
I am in agreement with everything that's been said to this point also. And then I had looked to see, we run into a problem a lot of times with access, finding someone to send people to. And one of the things I found, in looking at that is not only is it, is it a problem like, exclusive to us, but across the country, there is a huge lack or a huge need for more mental health support services, from psychiatry, psychology, all the other support interventions that go along with that. I think New York falls into the category of like 18 to 46 providers per 100,000 people with mental illness, and there's many more states that are worse than that as far as available providers too. So just the amount of people in the available to and qualified to treat mental illness is in great demand.
Yeah.
I was just gonna say, I agree with everything that you've all said. I was just gonna throw in that I think in addition to having a shortage of providers, I think a lot of times patients don't know who to speak to.
Mm-hmm.
So it's, even if they know there's different kinds of physicians, so they see other physicians for different other kinds of medical illnesses, they don't know which of them do I speak to. Do I take my primary care? Do I speak to a specialist? Do I speak to get a counselor? So I think there is a problem with, they may be able to identify there's something wrong, but knowing who to reach out to is, an avenue where we can tackle this from.
Oh yeah, that's a great point. Great point.
So yeah, can I add one more thing? When it comes to the school students, it's a peer pressure. Peer pressure plays a big role, like bullying, making fun of the other students. So that's also a barrier.
Absolutely. Is this more prevalent in a specific population?
That's a great question, and it kind of goes back to the second point. I think as mental health professionals, we have to kind of take responsibility of some of the stigmas. So I can give you an example from the African American experience. The initial APA, they used to make diagnosis. They had a diagnosis called drapetomania. How many people are familiar with the diagnosis of drapetomania? Drapetomania in the 1850s, 1860s, it was a diagnosis in which if an enslaved person ran away from their oppressor, from their master, they were diagnosed with a mental illness. And historically, there have been other really negative diagnoses like that. So as a profession, we have to blame. In addition to that, going back to really important points that were made about the importance of culture, you have to work with some of the spiritual leaders. If I have a patient from West Africa, my background is from the Caribbean. If I'm not connecting with the pastor or the imam or whatever, I'm not really going to make real headway. So I think understanding the cultural background and respecting that goes a long way.
Interesting
Can,
point.
can I add something to that? As I have experienced, I mean, like, it's more prevalent among the immigrants coming from different countries, including Latinos, Hispanics, African Americans, Pacific Islanders, and Asians, even in Southeast Asians, because there is no such thing as mental illness. It is considered as, they may think that mental illness is like a physical illness. So they may say that, okay, if somebody has depression, they don't say that I'm depressed. They say something else. I have a headache, I have this, I have that. But there is no such thing as mental illness in other countries.
Yeah. But also want to add to, in addition to that, sometimes some cultures will say that your illness is secondary to not being religious enough, not praying enough. So there's also that additional culture. Or even if you don't understand the culture, they may say that somebody may have put a curse on you.
Oh yeah.
So there's a lot of
yeah.
Going on.
When I was growing up, I mean, I have witnessed, because the people with the schizophrenia, it was treated like they were possessed with demons. And then they try to treat that with all this holistic, like, with the herbal, like shamanism and all kinds of other stuff. So that while I was growing up, I did not understand why that was happening. But looking back, the person with the schizophrenia, when he is hearing voices, hallucinating or delusions, that's what they were looking at. And I've heard, I do the mental illness among the multicultural ethnic population. There are lots of beliefs there. There are religious beliefs. They try to keep everything within the family. They don't really tell anybody. So it's more, and especially what happens to the immigrants. Okay, looking at my own example, I came from India. I came here to a strange country. So everything is different to me. It's culture. It's a East and West culture. So a lot of times people come, they kind of like, they get stuck between two cultures, and they're like, they stay inside the house homebound, and that can lead to the depression among females. Among the males, I mean, okay, they might lose their job because it's hard. I mean, the poverty may come up, and there are a lot of factors, but as I have seen, yes, among the immigrants, it's more prominent.
I agree with everything you both said. I will speak mostly to anxiety and depression, which are the two more common
Mhm.
mental illnesses that I see in clinic, because I deal with mostly with people who are 18 and above. So 18 from anywhere from 18 to maybe 102, 103 years of age. There is more of a female predominance. So it's 2 to 1. So more females than males have anxiety and depression. I think the US prevalence for anxiety will be about 13% of US adults have anxiety, and depression will be somewhere around 16%. In primary care, 1 in 5 patients that we see have at least one of the types of anxiety disorders. So anywhere from panic disorder to OCD, to PTSD, to generalized anxiety disorder. So it's definitely more common than it's spoken about in the general population. In terms of racial, predilection, I would say what studies show it's the least common in Asian, so maybe about 23%, and then next would be African Americans, about 35 and 38, Latinos, and 45% white Americans. So just to give us a bit of numbers and of of what we see in general population with regards to anxiety and depression.
And that's the key thing, because we're talking about anxiety and depression. So we're talking about, as I mentioned before, more the ego dystonic diagnosis, the diagnosis where it really, really bothers me. But we often miss the ego syntonic stuff. So the person's okay, but everybody around them is like, no, 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 no. So these are the kind of things where we have to kind of gauge. And yes, I mean, it's definitely a concern.
Very interesting. Very interesting. I noticed nobody said, or Chris, is like pediatrics. Is there, Dr. Oswaji mentioned 18 plus, but do you guys see it in peds?
It's similar. Like a lot of the statistical numbers are similar. We see a little bit higher prevalence in males, in boys. A lot of behavior disorders or mental health disorders get picked up between ages 6 and 11, which is no coincidence. That's when kids are going into school. So now you have educational professionals and all these people in contact with the child and kind of observing behaviors and all these kind of things. And it you have more eyes, so it's more readily picked up. One of our challenges, and one of the things I try to really focus on, is when we're seeing like the toddlers and we're doing those developmental screenings at like 2 years old, 3 years old, 4 years old. Are they talking? Are they walking? Are they meeting their speech milestones, their physical milestones? Because if they're not, those can be the first signs that you may have some kind of either neurobehavioral or some kind of other process going on. And that's where you have the room to then go to early intervention and these services that, again, like Dr. Oswaji mentioned, that people may not be aware of. And you have to really start directing them to these other sources in the community, because there are services available at no cost to every child in New York State through your local school district if they do have a failure to meet certain milestones. And that can really be like the first step in having the conversation about mental health in general. If you have parents that are receptive and willing to bring their kids for early intervention, and you really kind of have to help them see that as a necessary and helpful step.
Also want to add too, excellent point, Mr. Johnson. One of the most common diagnoses within children and adolescents from a mental health perspective is ADHD. And
Correct.
There are many forms of ADHD. So when we think of ADHD, we think of the combined type, the type where the kid is really, really hyperactive. And that tends to be a little bit more male, but there's also the ADHD, which is the inattentive type. And that's really scary. So that's basically the child that's sitting in the back of the classroom, just staring out the window. And because they're not really so active, people will tend to ignore that child. But the problem with ADHD, and this goes back to the issue, the question about what type of community where you find is very prevalent. Unfortunately, with ADHD, the best way to really treat ADHD is a combination of medication and treatment. It is so difficult for a parent to say that, let me prescribe my child a stimulant. That's very, very difficult. And this is where culture, even socioeconomic issues may come into place. I have a private practice in Manhattan in the Upper West Side, and I will have patients that will come to me and say, well, Dr. View, my child has ADHD. Can you give them the diagnosis? But I have to be very careful because there's an alternative gain. The alternative gain is that if I say that this person has this diagnosis, then this is good for their 504 plan. They can take extra time in exams. They can be prescribed stimulants. Whereas I can have other child in September, October, the kid is starting to fall behind, and parents are like, no way, this is not ADHD. And even though they have the diagnosis in multiple settings, school and at the home, the parent will completely deny. But right now, at the end of May, they say, well, Dr. View, can you start this child on a stimulant because they're in danger of failing the school year? Well, there's only a month left. I mean, how is this child going to catch up? So, and you find that, I mean, there's a socioeconomic perspective of that. There's a cultural perspective of that. So yes, understanding the role of ADHD. And what's bad about something like ADHD is that eventually these children will wind up self-medicating. If you have an undiagnosed ADHD, you can almost tell the fundamental diagnosis of a person by the drug of choice. You know, depressed person may use more alcohol, may use marijuana. A person that's very excited, anxiety will use a stimulant medication, whether it's cocaine or not. So there's a lot that's going on here.
Yeah, that's very interesting. Are there different signs and symptoms to look out for across like the developmental stages? You know, I mean, you mentioned using alcohol and like hard drugs and things like that, or you know, parents prescribing kids or trying to get providers to prescribe kids stimulants. Is there something to look out for as a parent?
I don't know. Dr. View, do you have any
Yeah,
info on
well,
that?
I would say one thing. If you have a child that traditionally has been doing well in school, and then all of a sudden they're doing very bad in school, that's a warning sign. That can be a sign of depression. That can be a sign of anxiety. That can even be a sign of trauma. So that's one thing. So, you know, kids all of a sudden is doing bad in school. Irritability. A 12, 13-year-old may not necessarily have the vocabulary to say that I'm feeling depressed, I'm feeling bad. But if all of a sudden they're very, very irritable, they're isolating, these are the warning signs that you have to be very cautious of as a parent. Irritability, isolation, suddenly a decrease in grades, and not really enjoying things that they traditionally enjoy.
Are those similar symptoms to you know, 18 plus, Dr. Aswaji? Would you say that that's similar?
Yeah, I'll also see that adults, I guess, have the privilege in the sense that they can, you know, vocalize what, I mean, they may have to have the diagnosis before they walk into our clinic as to what's going on with them. Yeah, being irritable is one for anxiety, being irritable, worrying about everything and anything that they can get to worry about. Being very restless is a sign of anxiety. For depression, you know, issues with sleep, either if you're sleeping too much or you're not sleeping enough. You know, if you're having any change in appetite, if you're eating too much or you're not eating, you know, enough. Dr. Ville mentioned this anhedonia, we call it anhedonia, but a lack of interest in what you previously liked to do is actually very specific for a diagnosis of depression. You know, if you have an elderly father who is, you know, in his 80s and he's like go fishing, and he doesn't do that as much anymore, that's a sign that he may be, you know, going through depression. Yeah, those are, you know, things we look up, people can look out for in maybe their elderly patients, and things that we look out for when patients walk in the clinic. We do have screening tests that we do for patients, both for, you know, anxiety, for substance use, for depression as well. When, you know, people walk into clinic, that helps us to, you know, properly cinch the diagnosis and figure out what type of disorder we're really dealing with.
Daniel, you have to unmute yourself.
As a family member, one of my closest family member got sick at the age of 12. He was a perfectly a bright student in the class, always A+. All of a sudden, his grades falling down. The attendance was low. So that it's like turning the switch off. And that's where our journey began. And I've been starting, she was 12 years and now that he's 40 years. So I've seen all these things, but it is really tough. It is really tough. I mean, and this, yes, as Dr. View said, well, withdrawn, isolated, not expressing what they're going through. And also, like, you know, depending on alcohol. I mean, it's not my son, it's somebody else. They do depend on alcohol because of the emotions are a lot more powerful than the physical pain sometimes. So that's what it is. I mean, a person is perfectly fine. It's like you turn the switch on and off, that's it. The whole thing will be changed. And that's what it, I mean, with isolating themselves, withdrawn, not talking to anybody. Those were the biggest things. Reckless behavior too.
Yes, yes, yes.
Mm-hmm.
Yes. Yeah, the reckless behavior is very common for the bipolar, the
Mm-hmm.
mad symptoms. But with that said, I know this is the self-care forum, so you have to kind of talk about some of the positive things, some of the things that we can do.
Mm-hmm.
A very important thing to kind of help with depression and even anxiety is the concept of exercise. Now, I'm not telling everybody to go to the local gym and spend like $100, $200 a month and lifetime, but just something, maybe 1 hour, 30 minutes of aerobic exercise a week is a good start. Okay, just, you know, just being active, moving, that helps the endorphins. So that's a very important thing. And another thing too, I've noticed is nutrition. Nutrition can play a very, very good role in supporting mental health. Trying to avoid the sugary diets, having a much more, you know, healthier diet, eating vegetables, eating healthy, really avoiding sugars and unnecessary starches as much as possible. So these things, when it comes to self-care, that's important. Avoiding things that are very addictive, such as cigarette smoking, you know, unnecessary alcohol use. Those are all powerful things. And also minimizing substance abuse, such as cannabis. And I know that marijuana is very popular, legal now, but it does have some deleterious effects as well, especially if you're predisposed to psychotic-like symptoms. So when you talk about self-care, these are all important things that we should incorporate. You know, more mindfulness, more meditating activity, even journaling, you know, writing, you know, these are all healthy things that we can do to maintain that self-care perspective.
Yeah, I definitely want to address physical health. I just have one other question before we move to that. Does emotional health differ from mental health, and can it change over time?
I think that it does. I mean, I'm not a psychiatrist, but to me, I kind of interpret emotional health to be a little bit more of a uh, of an immediate kind or a flow, more acute kind of state, a free flowing state where you're confronted with different things that you're reacting to. And certainly if you're confronted with enough things that you have to react to in a negative way, you may become more primed to react in that negative way and then develop into like a more of a global mental type of illness. I don't know if that's a correct interpretation. That's kind of the way I looked at it.
That makes perfect sense.
Okay, so let's talk about physical health. Dr. Vu, you touched on it here. How does it affect your overall health? Is there like, chronic illness? And I know we have the Warrior Kids program at Garnet Health that we address nutrition, like you said, and like screen time and things like that. That has to affect your overall well-being, right?
Mm-hmm. I mean, definitely. And I also want to add, I mean, there are certain diagnoses that the first presentation is a mental health component. So, for example, pancreatic cancer, the first showing of pancreatic cancer is depression. Heart disease is associated with that. So there's definitely a medical component. With that said, I do think it goes back to the issue of self-care and really focusing on having, trying to have that healthy lifestyle, and not, not utilizing negative things that can actually exacerbate negative things within your well-being.
I would throw in that insomnia, which is a lack of sleep or poor sleep, is in itself an independent risk factor for anxiety and depression. Mm-hmm. So if you're not getting enough sleep, there's a high likelihood that you would suffer from one of those two mood disorders. Exactly. And I do agree that, it's chronic medical illnesses and mood and mental illness are very intertwined, particularly like things like heart disease or, like long-standing diabetes or kidney disease. It's more likely that patients who suffer from that would also suffer from mental illness, because as you can think of, it's heavy disease burden. They have to be on multiple medications. It's many hospital visits. It's just walking around knowing that even though you're getting the best treatment possible, it's likely that your lifespan may be more protracted because you have this chronic illness, and that of course can take an emotional toll on anybody. So all of those things have a role to play in the level of mental health illness we see. And yeah, I agree with exercise and aerobic. Any kind of exercise is great. About 150 minutes per week is recommended. The great thing is it helps with your mind, but it also helps you with your body. So I always tell patients it's exercise is the best free gift ever. Because it helps you. It's holistic. It's like holistic care. To me, it's better than any pill, in my opinion. Yes. And it's also important to, as much as you can. I know, this is times with, and we'll get to talking about COVID, I know, but we're all sort of isolated. But it's so important to, as much as you can, surround yourself with people who, care about you, that you can like reach out to and like speak to and things like that.
I would like to add something. We always encourage young students, the middle school and high school students, to talk to a trusted adult about what they're feeling, even if it is a janitor, a bus driver, doesn't matter who it is. Talk to a trusted adult. And these are the things we, when we do the Ending the Silence presentation for the school districts, we teach them how to recognize the early signs and how to help that person who is in emotional distress. And also getting involved with the community activities, like just volunteer with something, going for a walk, hiking, whatever they are interested in, hobbies, all those things can help.
Mhm.
Yeah, it's very interesting. So is it like hormonal, or what is it about physical activity? And you guys mentioned like a lot more like aerobics, so you want to like increase your heart rate and things like that. What is it about physical activity that improves your mental health?
Well, it can be the chemicals in increasing the endorphins. And one of the key, I mean, when we talk about mental illness, we're basically talking about chemical imbalance, specifically of serotonin, dopamine, and norepinephrine. And when we think of serotonin, we usually think of serotonin mostly in the brain. But guess what? The most amount of serotonin is in the gut. So this is where diet comes into play. In fact, in the field of psychiatry now, there's we call it the gut microbe revolution. I mean, a lot of psychiatrists are really getting into nutrition and all of those content because they're realizing that
Mhm.
it's even the concept of obesity. It's a mind aspect as well. So if you can kind of control the mind, that within itself can control what you're basically taking in. So it goes back to the concept of the holistic part of it. And we mentioned nutrition, we mentioned exercise. I cannot emphasize enough about mindfulness, meditation, yoga. It's amazing, within psychiatry, within primary care, within the past 150 years, it's not even 100 years, 50 years, we've had this revolution of medications: Prozac, Seroquel, Trileptal, name the latest drug. But what got humanity to this point has been mindfulness, it's been forming communities. It goes back to the initial question that was asked. I mean, and even when we spoke about how many immigrant communities may have higher mental illness, but well, the thing about people don't realize that just the concept of leaving one country to go to the other country is a very traumatic effect. You're changing the weather, you're changing the clothes that you may wear, you're changing the diet that you may have. I mean, the entire family structure is problematic. So that within itself predisposes you to vulnerability. That's a vulnerable aspect within itself. So all these things come into play when we talk about true self-help care, and just being gentle, understanding ourselves, being not being too hard on ourselves, being able to appreciate the simple things in life that are not necessarily that expensive.
Yeah, no, that's great. So we are starting to get some questions from the audience, but before we jump into that, I just want to say, can we talk about some treatment options and some things that Garnet Health offers? Um, you know, I mean, we have a number of support groups and therapies. What do you guys recommend?
I'd like everyone to know that that most mood disorders are actually treated in primary care clinics. So if you're out there and you don't have a primary care physician, we have a number of them at Garnet Health. I'd recommend that you you get plugged in with one of us because it's a high likelihood that you'll be treated by a primary care physician again. So that's definitely one avenue to look to. And I mean, we inculcate both pharmacotherapy, which is medications, and psychological therapy, in conjunction with behavioral health. Dr. Bill's team helps us. Um, yeah, so I mean, some patients would opt to, have only therapy, while some I have patients who walk in and say, you know what, I know this is what's happening to me. I can identify that this is what I'm going through, and I would like to start medications for it. So it's really, we work with the patients, really up to them and what they prefer. And some people start with one kind of therapy and switch to another, form of therapy down the line, or we use both together. But again, like Maura mentioned, there are a number of support groups that we have at Garnet Health. And I know Dr. Brooke can speak to this, to what happens in psychiatry. So.
Yeah, well, thank you, Dr. Swayze. I mean, I also want to mention, specific with Garnet, we have a relationship with the primary care team. Our residents, because we have a psychiatry residency program, they actually rotate in the primary care clinic. And we love that because that's kind of in vivo. And our role is to kind of help patients that may not feel comfortable going to seeing a psychiatrist, but they've already have a relationship with their PCP, because the primary care provider is in the front lines. And as Chris had mentioned before, we don't have enough mental health providers. Well, one of the ways to help alleviate that burden is empowering our primary care providers, whether it's medication, whether helping them start a medication, whether we need to increase the medication, whether we need to bring the medication down or taper it down, introducing specific some type of therapies, whether it's CBT, i.e. cognitive behavioral therapy, or even motivational interviewing for a person that may have a substance abuse disorder, but the substance abuse disorder is still within the egocentric perspective. We work very, very, very closely with the primary care team at Garnet.
Yeah, that's fabulous. That's fabulous. In terms of support groups, I just want to throw out there that we do offer Circle of Hope. We have caregivers support groups, and we have support groups for stroke victims, heart health victims, pulmonary respiratory victims. So I just wanted to throw that out there, but I'm super excited that you guys, kind of address the primary care component, because that's huge. That's something that you don't even really think about, All right, so we have, or Daniel, was there anything that you wanted to?
I would like to add the person-centered language. When somebody is going through the mental health signs or symptoms, some of them, because the words are very powerful, we all know that. When somebody is behaving like, out of the normal, calling them crazy, psycho, wacko, all those words, what do you think happens to those people who are listening to these words? Mm-hmm. It devalues them. Also making jokes at their behavior, insulting them with the comments, patronizing them, all those things can affect their self-esteem. In the first place, these people with the mental health issues have very, very low self-esteem. And that may lead to the, feeling worthless, suicidal ideations. So we definitely, at NAMI, we always the highest emphasis on using the proper language. When somebody is suicidal, we do not say that he committed suicide. We do not use the word committed, but we say he died by suicide, because committed sounds like committing to an institution, committing a crime. It gives a negative feelings. So we, and also how many times we hear, when a person has schizophrenia, how many times we hear people calling him schizophrenic. I mean, every time I hear, I have to tell them, please do not call the person schizophrenic. We use the person-centered language. We see the person, not the illness.
Mm-hmm.
Yeah.
Like I said, that is true. You would not, walk into another medical context and, refer to somebody as like, coronary artery blockage or something. You know what I mean? It's,
Yeah. I mean, when somebody
know.
has cancer, we don't say, hey, he's so cancer. Why
Right.
would we say somebody with the schizophrenia is schizophrenic?
I think what would be great though, we've mentioned all these groups and stuff, and we're talking about the links in between physical health and mental health, and also the person-centered language. I can tell you, walking around like, in the community, whether like grocery shopping or whatever, I've heard numerous people either talk about the surgery they just had on their knee, the stents they just had placed in their heart, all these various different, or their arthritis or aches and pains, or all these various different, relatively common, medical, physical problems that we run into or that are experienced by a lot of people. But, we talk about all these statistics of people that suffer with like anxiety, depression, stuff like that. Rarely do you hear people standing around saying, well, my depression was really bad, or my, this was really bad. And, I do see it, having an 11-year-old daughter, and this goes back to the person-centered language. I feel like, and dealing with kids a lot too, there is an awareness to some degree, and a certain degree of kindness and awareness about and sensitivity to those issues, and avoiding language that, as they like to say, is triggering to others, as far as whether that is exacerbating, either anxieties or aspects of whatever emotional or mental problems someone might be going through. And, if we could, kind of bring mental health to that same level of just casuality in our daily day conversations, and feel as comfortable as talking about that as other things, and offering and reaching out to people, and feeling comfortable if we were going through crisis to reach out to others, which could be tough. If you are going through those symptoms, I think that ultimately things like this program here, this webinar, would be aimed to do. It would be a good result to get closer to that, so that it's not something that is, making people uncomfortable to talk about. You have to tiptoe around too,
And how many times we see people taking flowers, cooking good food, and taking to a person with the physical conditions. But have you ever seen anyone
Absolutely.
doing the same thing to a person with the mental health conditions?
Exactly.
I don't see that.
Mm-hmm.
Good point. And I also want to kind of add, so this is a kind of like a funny anecdote, a very funny story. Before I came to Garnet, I was working in Mount Sinai Hospital in New York City. And one of a good friend of mine's, he's a primary care physician. And whenever the two of us would walk in Harlem, it was like this guy was like the king of Harlem. Everyone would just stop by and say, "Oh, Dr. Bayo, how you doing? How you doing? How you doing?" If I would see one of my patients, literally they would like cross the street. I mean, it was like it was complete avoidance. And I used to say, "My God, Dominic, this is great. I mean, your patients really love you." And I know that my patients cared for me as well, but just even that stigma is it's so profound. And again, going back to the thing of Garnet, I mean, this is one of the reasons why we try to have that psychiatry, mental health presence within that primary care setting to help destigmatize these issues.
Yeah, so on that note, Dr. View, we do have a question, and towards the end, this is a good question. So, have you noticed an increase in mental health disorders since COVID? If so, what disorders specifically, and how can we begin to encourage individuals to adopt a healthier lifestyle?
Unfortunately, the answer is yes. And one of the concerns that we've had is because of not going to school, staying at home, we've seen a lot of domestic violence issues. I think that's a major problem. And I think what are some of the solutions? The solutions is supporting marriage family therapists, more therapy perspective, because that's not necessarily a medication per se. It's more of the therapy, more of the community buildup. So I think that's one of the things, unfortunately, we've noticed the increase of domestic violence. There is a concern with having kids, not actually being in school for a year. That socialization perspective, that's a major concern. I mean, so yeah, these are some of the issues that we're dealing with. Unfortunately, yes.
I would like to add something. From NAMI, we are really demanding, not asking, we are demanding to have the crisis stabilization centers. They can just walk in,
Yes.
maybe 2 or 3 days, because the ER visits are very expensive. So we are really asking the federal agency to provide the funding for the opening up the stabilization centers.
Yes, oh my gosh, I definitely concur. Because if you look at our emergency, going back to the question of whether we've seen this COVID, our emergency department, believe it, has almost 20% mental health issues.
And according to my experience, I mean, a lot of times these people need someone to talk to, you know, and they don't have to go to emergency room for that.
Exactly.
And taking up the police time, the law enforcement time.
Yeah.
Same in primary care. We've seen an uptick in patients just coming in wanting to talk. And I know it's all secondary to COVID. It's I guess this is, I'll definitely say for the most part, psychiatry and primary care are at the forefront of this pandemic with regards to like taking care of mental health and the like load of patients we're seeing from this. But yeah, again, I think Garnet Health is very well equipped to deal with this and handle it. So
and also increasing the peer support. Independent Living Center, they have it's a peer agency. I mean, somebody with a lived experience, they will come home, they will talk to the person, so they relate to them more to open up and they guide them in the right direction. The peer support plays a big role.
Wow, this has been great. So we do have a couple minutes left. So I do want to encourage our audience to ask any questions you guys might have for our panelists. And in the interim, what are some things that you guys do for your mental health?
Me specifically? I do like the exercising and I do the mindfulness practicing and like some, I do incorporate like yoga, stretching, that kind of stuff. And I do try and, if I don't get a chance to exercise, I do try and take at least like at lunch hour, typically I get a break where everybody leaves the office between 12 and 1 and I don't live nearby. So I stay between that 12 and 1 time. I try and turn off like the computer. I don't do any charts. I turn off my phone and I just sit there and try and have a quiet mind. I'll have a little food, but then 40 minutes I'm sitting there just quiet, and I think that's been a great help.
I'd say for me, day to day, I try to get enough sleep to start with. I'm usually in bed at 10 p.m. Trying to get 7 to 8 hours. I think it's really effective in just helping me to function as a person every day. Exercise wise, I do Pilates 2 to 3 times a week, and I leave a class and my mind is completely transformed. And I'm somebody who likes to speak to people around me, like family and friends, so I really stay connected to my loved ones. And praying as well helps me a lot.
I'm going to jump in with a question from the audience real quick. What would you recommend for someone suffering from a chronic disease and is starting to become discouraged by their disease as a place to start to maintain mental health or to keep their mental health strong?
Well, I just talk from from my personal example, one of the things that I use to help my mental health, and I think this may somewhat relate to the question that's at hand, is that for me, spirituality is a very important thing. It's very important, and for me, spirituality. I mean, I'm a firm believer that the Creator will never give a soul more than they can handle. So that concept of spirituality has really helped me tremendously. Um, and again, I mean, I'm not necessarily telling what specific dogma a person should follow, but that's something that I found to have been to be very helpful. You know, bottom line is trying to get some meaning in life.
I would like to add something else. Attending the support groups, going to the support groups, hearing from other people what they are going through, they may feel that they are not alone.
Mm-hmm. Mm-hmm.
Yeah, that's a great point. That's a great point. Dr. V, what do you like to do for, well, you mentioned you like your spirituality and things like that.
I also like listening to music. So any David Matthews or Tribe Called Quest, you know, classic music like that. That's my thing.
Oh, nice, nice. Danu?
Yes, when I'm in New York, right now I'm in Columbus, Ohio with my daughter. So now I go for a long walks. I take my little grandson for the walks. But when I'm in New York, nobody can catch me. I'm an obsessed gardener outdoors. And that I mean, outdoor nature has a really healing power.
Oh my gosh, that is such a good point, because if you look at areas of communities of high depression, and I think that's going back to one of the initial questions, you find that in certain regions where there isn't much sun, issues of depression, mental health illness actually rises. Whereas in areas where there's a lot of sun, depression really isn't, it's still there, because, and the problem may be more of a financial socioeconomic, but if you have the finances and if you have the sun, you know, usually you're doing okay. So I think, you know, I think environment weather plays a big role too.
We have an additional question. Do you have any advice for healthcare workers who've been on the front line of this pandemic, especially those workers who have long hours and very little time off to take care of themselves?
One thing at Garnet Health, we have a doctor by the name of Dr. Kim Arrington. She's a psychologist. And we actually started a form of therapy called SIDS, which stands for Stress Inoculation Training. And Dr. Arrington actually brought this type of therapy when we were studying to see how we can help, especially our residents during the COVID-19 pandemic. But that was a very, very stressful time. So this training was based in what they were doing in Wuhan, China, to actually address this very, very issue at the rise of the epidemic. And SIDS, to kind of explain it, is really more of a mindfulness. It's a group type of therapy where you're doing breathing exercise. You're kind of reflecting on processing what people are going through. There's a imaginary perspective. So I think from a provider perspective, trying to get into groups with other people, that within itself can be very structured. Now, the key thing though, you kind of need to have kind of like a leader, because if it's just a bunch of people talking, and you know, that within itself can lead to a lot of stress and a lot of anxiety. But having it within a structured environment can actually help alleviate some of the stress.
Yeah, great question.
I would say self-care, even if it is 30 minutes, self-care. That's what it is.
Definitely. Well, it is 8:01. I'm going to share my screen. I want to share the resources that Garnet Health has. So here we are. You can, if you're in need of a primary care provider, pediatrics, psychology, you can find Dr. Aswaji, Chris Johnson, or Dr. View at these locations and at these phone numbers. And additional resources I've included here, NAMI of Orange County NAMI, and garnethealth.org. So again, this panel discussion has been recorded and it will be available on Facebook and our Garnet Health website for anybody who's missed or interested in revisiting some of the topics. And please feel free to reach out to the Community Health Department at Garnet Health should you have any additional questions, and we can get you connected to our providers this evening. So again, thank you panelists for joining us, and I hope everybody has a great evening.
Thank you so much.
Thank you guys so much.
Bye.
Bye-bye.